Frontline workers can be viewed as the backbone in terms of striving to get through the COVID-19 pandemic, although their mental health has been hit hard by stressors, anxiety, fear, and more. Dr. David Edwards, medical director at the Student Health Services at Texas Tech, said he has found these times challenging not just for himself, but his colleagues and frontline workers in the medical field in general.
It's been challenging. Physicians in general are trained to have this mentality of the patient's needs come first, and they do. At times, however, that can be to the detriment of one's own self-care as a clinician. And so, it's the old adage that says, "Physician, heal thyself." Well, if the caregiver is broken, then it's very difficult to provide good care. And so we're seeing rates of burnout in the field of medicine that are higher than in many other fields, especially during the pandemic. Not only, concerns and anxieties about personal health, taking care of patients sometimes without enough PPE, personal protective equipment. Fortunately, that has not been the case here, but you read stories of that happening elsewhere. And then dealing with personal loss, loss of colleagues, loss of patients. So it's been challenging.
A staff physician at the Student Wellness Center on Texas Tech's campus, Dr. Miguel Viall, said times have certainly been very different, and he is just trying to get by one day at a time.
And getting by. Fortunately, I'm fairly low-key, kind of person. A lot of my hobbies don't require me to be around other people, so I can still, do some other hobbies. Don't get to eat out or anything like that. So certain things that we used to use for stress relief, like, we're tired, nobody wants to cook, let's go eat out. Let's go to a restaurant and eat out and kind of have a nice relaxing meal without having to cook ourselves. It's not there, and so now it's just kind of how do you do that? How do you get by? And how do you share the workload at home so that one person's not having to do all the cooking? But it's been a challenge. It's kind of a day by day kind of let's get by, let's find something to do, something to kind of keep the brain stimulated.
Logan Hinrich is the Associate Clinical Department Administrator at the Student Wellness Center. He said his staff is very important to him and acknowledges how everyone is different in terms of getting through tough times.
Well, I think for me it's been very clear that people are responding to the challenges we've had over the last year very, very, very differently. People they interpret stuff differently. They evaluate risk differently. So people are really all over the map. And so I think it's really good if you're trying to lead a complex team like we have here, with people with different levels of education, different amounts of years of experience. There's just so many differences in how we form the team that we have here that I think it's critical that people have the ability to process through what they think is going on and process through how they're responding to it all. And there's going to be some that this is not that challenging, it's not that stressful, it's not that challenging, but there's others that it really is. And so the more open communication, I think that everybody kind of realizes that there's not one way to walk through this, so therefore there's not necessarily a right way to walk through this. And we really need everyone's perspective to help balance out some of our own excesses and how we might be interpreting the crisis that we're in right now.
Hinrich said, "Times like this don't last always, and that is a very important thing," he reminds his staff. With staff in mind, Dr. Edwards encourages his staff by speaking about perspective and how sometimes perspective can get you through these days.
There's an interesting story that I shared with our medical team about perspective earlier in the pandemic, and it's the legend of the lost horse. It's a Middle Eastern legend. It says, a man's horse ran away. His neighbor came to him and said, "Bad luck that your horse has run away." The man said, "What do I know of these things?" But a week later, the horse came back with 20 wild horses in his wake. The neighbor said, "Good luck. Now you have many more horses." The man said, "What do I know about it?" Trying to tame one of the new horses, the man's son was kicked and his leg was broken. The neighbor said, "Bad luck, your son's leg being broken." The man said, "What do I know about good luck and bad luck?" A few days later, a bunch of thugs came by in search of able-bodied men for their gang. They were about to kidnap the man's son, but when they found out that his leg was broken, they left him behind and moved on to the next house. The neighbor said, "What good luck that your son's leg is broken." So just, illustrating that life doesn't really make sense sometimes.
Right.
And again, perception doesn't always equal reality. And so we do the best we can, and we try to prioritize, and execute accordingly.
For Texas Tech University, this has been Kritzia Williams.